Hello, everybody, and welcome to Valley Life. I am Rich Krebs, and I have a great segment that I'm about to bring to you from Valley Cardiac Surgery. And the reason being is there are a lot of doctors you can find in the area that have a heart. It's really tough to find a doctor with a sense of humor. This man is not only a professional, but he also brings things to light to make you feel better about what's about to happen. And what I'm telling you is about to happen will make your life a lot easier. Dr. Chaudhry, how are you, sir?
Pretty good, sir.
Good.
Thank you.
It is so good to see you. I'm really excited. And of course, I'm bringing to light, a sense of humor, but you like to make your patients feel more comfortable before they're going into surgery, but the types of surgery you like to perform make them a whole lot more comfortable afterwards because it's so much less invasive. And I believe it's called MICS. Give me a little background to MICS and why the minimally invasive is so much easier.
Yeah. Minimally invasive, the term has been invented in heart surgery for a long time. This is not anything new. People have talked about hybrid procedures where they just do one vessel bypass and the rest of them just done with the stents.
Okay.
Or they will do just with, people have talking about robot. Somebody had robotic surgery. Actually, robot never touches the heart. They just take a one vessel, memory vessel, and then they make same incision and end up doing the bypass. Or they used to call it mid-cap, T-cap, and everything, that they split the sternum to some degree, and then they call it minimally invasive. Whole word minimally invasive came that you are not opening the sternum. Sternum goes from the neck all the way to the belly, and splitting that open, mind you, it's about 1 centimeter wide. You split it, you're cutting it, although it's a controlled cut, but it's just like fractured bone. Okay. And you put it together. And psychologically effect of this opening and splitting the bone and having incision and scar from the neck all the way down on a patient is so huge that the first thing they will feel like that rest of their life they are disabled. And actually they're not. But
Even though it's just a cosmetic scar.
But it's a huge thing because it takes about 2 to 3 months. Just like if you're a football player, you fracture your bone, it takes about 6 weeks to 8 weeks just the bone to heal, then you start putting weight, then you have to do the exercises to get back. So it's about a 90-day period, 3 months. Okay. With the minimally invasive, now what we are talking, and the stage where we are and in the advance, and it's just making a very small, about 3-inch incision under the breast. For females, it's right at the breast crease. For males, it's also, but it's barely you even see it. In females, you never see it. Even if you put a bra on, nothing, you cannot see the scar. And just going through that, and in 2 to 3 days after the surgery, the patient is home. But the beauty of this minimally invasive is not that we're just doing the one vessel. Now where we are, and technically we have gone to with instruments and training, that we can do complete I think the word here is a complete revascularization. Whether somebody needs 2 bypasses, 3 bypasses, 4 bypasses, 5, we do exactly same what we used to do by opening the chest.
And by creating such a smaller incision, like you said, the rehab is so much faster. They're back to their life sooner. When you talk to people about this, you've got to see the strain in just their neck and shoulders just drop when they realize this is going to be much easier than I initially thought.
I will give you an example. I just recently, we did last month, we operated on one of a lawyer from Fresno. And within 2 weeks, he was back to work. And within 1 month, I saw him just last week after 30 days of his surgery. He has already gone to Miami for vacationing and come back within a month. It was unheard of. These people, we didn't even let them go on a train or huge ride, or you can go to LA, or no, you stay in town in case you have a problem, any of these things. What this has done, and especially if you look at in the Valley, it's not just rehab for the patient. The bigger concern has always been, since I've been doing this cardiac surgery, and especially being in Fresno for past 7 years, we don't have a GM motor company here or the Ford where you can take 3 months off. Even the job, you have a great job. A lot of people have great jobs and they're happy. But this day and age when our unemployment is over 16% in Fresno, small businesses, you take 3 months off. They have already hired somebody. Now you go back, you don't have a job, your insurance is run out, and you are living on workman comp for how long? Yeah. And after that, you can't find it. These people, the target is that within 2 weeks, 3 weeks, they go back to work.
Dr. Chaudhry, I think that brings up an important point that, people think about the Central Valley. We're still in the mindset that Fresno is such a small town. But now with the type of surgeons that you've put together here, we don't have to go to Stanford anymore, San Francisco, San Diego, or Los Angeles. The best of the best are right here in the Valley.
Rich, it's funny that you asked that. Nobody in San Francisco or Stanford or LA is doing this.
Isn't that amazing?
So we are ahead of the ball game. on this. We are at the cutting edge. And although I'm a heart transplant trained, only thing Valley Cardiac Surgery right now is not doing is the heart transplants. Anything else you can think of in anywhere, not in any city, anywhere in the country or anywhere in the world, we are doing in Fresno.
I love it. Dr. Chad, it's been a pleasure speaking with you. Thank you so much.
Thank you, man.
We've got more Valley Life coming up right after this, but Valley Cardiac Surgery, the place to come, and it is the best of the best. And trust me this, I've interviewed quite a few of these doctors. They know what they're doing, and there's no reason now to think you have to go anywhere other than the Central Valley to get the best training, the best procedures, and also the less recovery time. Don't go anywhere. More Valley Life after this.